Welcome. I'm Jane Kurth, CEO of FitFix Now. We do continuing education for fitness professionals, and I'm a retired professor in kinesiology and health. I'm excited today to be doing this with my friend, Dr. George Steele, and we're actually in Philadelphia, Pennsylvania at his lovely home recording.
Okay.
And I'd like for George to tell you a little bit about his extensive background as a physician.
Okay. Well, thank you. It's wonderful to be here and to have the opportunity to share what I've been, working on for the last numerous decades, I guess. So I went to medical school in North Carolina, the University of North Carolina.
Great school.
And it's a great school, and I was after working full-time as an auto mechanic between college and medical school, which was in fact my first true love, but now I like working on people as well, because in many cases they are much more complex than our automobiles. And then I did an internal medicine residency at Brown, and then came back and spent a year at Duke doing a general internal medicine fellowship, and then joined the faculty eventually at the Medical College of Pennsylvania, which was the first women's medical college in the United States. After 5 years there, I was the head of ambulatory education, and we had teams of residents taking care of our patients, along with 3 faculty members. And then I went to the University of Pennsylvania, where I stayed for 9 years, practicing internal medicine, working inpatient on the inpatient service at the hospital of the University of Pennsylvania, and then working in the outpatient clinic as well as having a private practice. We were sending our children to colleges, so I actually went into drug safety in the pharmaceutical industry for 10 years. Where I was very unpopular with people who were not doing the right thing, because our group, in fact, was very successful in trying to make sure that the patients and the subjects in our clinical trials stayed safe and that the benefit continued to outweigh the risk. I clearly am concerned about the adverse effects of medications and trying to do things as much as we can with how we're living our lives rather than depending on pharmaceuticals to move us toward wellness. And then I came back into practice 3 years ago and enjoying what I'm doing.
Yes.
And I'm very happy to be here.
Yes. Well, George and I have been friends for a long time, and I've really followed what he's done and his real passion for helping people live healthier lives. We want to live a high quality of life,
right,
and then die quickly.
Yes.
Yes. You don't want to live a poor quality.
Fall off at the cliff at the end.
Yes.
Right.
Yes.
Right.
So we've got a lot of information within this course that will give you information to help yourself, to help others, because we just really want to get you healthier. So thanks for taking the time, and George, let's go into the course.
Okay, great. Okay, let's do it.